We come to the most interesting session of the day, and that is our 1-minute poster presentations. Thank you very much again, audience. You're most welcome to this very, very interesting session. And we're going to start right away with, first, we're going to have the members who are physically in the room. Then we'll go to those online. And each will have 1 minute to convince us of the research output, because policymakers don't have a lot of time. They need to convince them in 1 minute. Thank you. Okay. So we are going to start with our very first presenter, we're going to start with Mohammed Osman. Please come on stage. You have 1 minute. Thank you. Yes.
Okay, so national household level surveys that are used to generate indicators on dietary and nutritional outcomes are often only representative to the first geographical administrative level. However, policy and program decision makers are often interested in having insights for smaller geographical areas. But this is usually not possible using conventional methods of analysis due to limitations in the survey design. So to address this, we've applied hierarchical Bayesian spatial models that leverage the underlying spatial structure of the data to provide improved estimates at the second administrative level. We did this in a case study that used data from Nigeria to estimate the inadequate intake of micronutrients. So if you're interested more in this piece of work and would like to know about the methods, and come and say hello to me, I'm Mohammed Osman, a data scientist from WFP working on the modeling and mapping inadequate micronutrient intake team. And I'll be at poster number 46.
Thank you very much. Can we have our second one, Andrea Bolongo? Please take on.
Okay, so raise your hand if you have ever been involved in a market study where you, or more likely, thank you, a local member of your team has gone market to market and vendor to vendor asking questions like, how much for this kg of super rice? How much for this heap of carrot? And this cluster of indizi? How much? 5,000? That's outrageous. I'll give you 3,000. So now, what if I told you that there's an amazing new app you could use to avoid all that hassle? In this app, real-time prices are provided for every food imaginable in most urban areas globally, including low-income countries. It's free to download, free to use, and works on iPhone and Android. Amazing but true, because food delivery apps like Glovo in Uganda, Piki in Tanzania, and so many others around the world are indeed powerful food price research tools already at your fingertips. So in this Imana-funded study, I set out to explore whether, in fact, food price collected...
Thank you. Thank you very much. Thank you. Can we have Gian Nirajhambere? 1 minute.
Yeah. Imagine a world where vulnerable groups can afford a healthy diet. I'm pleased to share a key insight from consumer preferences and the consumption study conducted by TSI and the CNFA USAID-funded activity in Rwanda. The study explored how agriculture and market systems can better support nutrition and health outcomes by understanding barriers and opportunities in consuming 7 nutrient food. Our findings revealed that knowledge of a healthy diet is high, but actual consumption is constrained by poor availability and affordability, particularly in rural areas. Consumers rely on step food and have limited access on targeted food due to low market presence and high prices. The study recommended shifting from awareness campaign to strategy that improve last mile access, affordability, community level production. Thank you.
Thank you very much. Our next one is Christopher Tan. I'm going to ask you to come right in the middle here so we can all see you. Thank you very much. Yes. Go ahead.
Okay, hi everybody. So this project is about ultra-processed foods, so I'm going to keep this short and sweet. This is a political economy analysis of the food industry, which is based in Ghana. If you're interested in how we took a food environments approach to understanding the political economy, then you can come and visit us at poster number 50. So we did a workshop methodology with adolescents in 4 schools. We use participatory photography and focus group discussions with photo elicitation to really understand that lived experience of ultra-processed foods as part of daily life in this setting. We also developed an exhibition for 1 month where we had a photo exhibition, and we brought all the stakeholders together, including all the adolescents from the schools, and they then developed these action plans about how to improve their school food environments. So if you're interested, as I said, come and see us at poster number 50.
Thank you very much. Thank you. Can we have next Fanny Sandalinas, right in the middle? Thank you.
Hi, so I present here two maps. So on the left, you have vitamin B12 status in women in Ethiopia assessed by biomarker. And on the right, you have the low intake of vitamin B12 in the diet. So these two maps look very different. People don't eat vitamin B12, but they are not deficient. So what's happening? And we think that the issue that we also see in other countries, in India, in Nigeria, comes from the consumption of fermented food, because during fermentation, an inactive form of B12 is created, and this inactive form can be picked up during the biomarker assay. So people appear to be non-deficient in vitamin B12, where actually they are deficient, and it might be a contributor to anemia. So in countries where there's a high consumption of fermented food, we should use a new biomarker that only measures the active forms.
Thank you. Next, can we have Sue, you're on call, right in the middle. Thank you.
Hello everyone, I'm Suyam from University of Nottingham, Malaysia. My study objective is to investigate the association between food access preference, dietary behavior, and nutrition outcome among the urban population in Kuala Lumpur. So this study, I used the PPGIS method, which is the public participatory GIS method, where respondents geocoded the food outlet they frequently visit based on food outlet typologies for both grocery and eating outs. So this method able to capture the real lived experience in terms of where people buy food and how people interact with their food environments. So the resulting map show that the food outlet frequented by people are scattered beyond their residential neighborhood and highlight the key food hotspots. Interestingly, as you can see from the maps, so the food hotspot for both obese and non-obese people are similar. The travel distance also similar. So it raises an important question: if people are access to the same food environment, why the nutrition outcome differ? So please visit my poster number 52.
Thank you. Next, we're going to have Rose Vastratren, but she's not here with us. She'll be represented by Thalia Spalling. You have 1 minute.
Thank you. You are what you eat, but what does that mean in food systems? So we dove in, 125 studies, coded, mapped, categorized, asking how are food systems studied. From Europe to Asia and LAC, quantitative ruled while mixed and qualitative rose. We saw diversity, yes, but also disconnection. Health and nutrition, underrepresented. Equity, a third. Social and climate threads, still waiting to be woven in. Though methods were many, complexity didn't mean full capture. An opportunity, build methods as purposeful and dynamic as the systems they study. Blend data with stories. Reap equity in experience. Root in many truths, choose Earth. Come see how we do and can study complex systems at poster number 53.
Thank you. Thank you. Can we have Triley Matongera next?
Our study focused on nutrition vulnerability mapping in 4 countries. We used GIS to combine multiple factors to determine nutrition vulnerability index. Our results are consistent in 4 countries. There is high nutrition vulnerability in low-income neighborhoods, which are also high poverty risk. So just yesterday, we had a plenary session that was talking about intervention approaches to improve access to healthy food. But there was a missing puzzle. The question I have is, so when do we have these intervention approaches? Where do we begin? What are the priority areas that we should look out for? The nutrition vulnerability mapping will give you those answers. So in this regard, I invite you for a meeting at poster number 54 so that we discuss in detail these important issues. You come with the intervention approaches, I tell you where to begin.
Thank you. Next, we're going to have Constanza Di Matteo take on the stage.
So risk-benefit assessment is an interdisciplinary framework that can support food policy decisions by evaluating trade-offs between different health components present in foods. With a food system and a future-looking perspective, we adapted part of this framework to target emergent risks. So we conducted a case study focusing one health outcome, aflatoxins and hepatocellular cancer, and we predicted the impact of increasing temperatures due to climate change on aflatoxin contamination in maize and maize-based products in France. So we looked from production at farm level to consumption, and in our scenarios, we did observe an increased risk of hepatocellular cancer cases, suggesting that there might be a need for reinforcing food safety strategies on this matter. Since our models are adaptable to different national contexts, I invite you to come visit poster 55 to know more. Thank you.
Thank you. Thank you. Can you have Martin Chegere?
Hello. So currently we know that malnutrition is very prevalent in sub-Saharan African countries, even in Tanzania. And due to that, rising food costs limit the ability of households to access healthy diets. And due to this, in our study, we wanted to understand the effects of food costs on dietary diversity while taking into account the gender context and also the rural and urban context. And we used the National Panel Survey data, specifically the LSMS World Bank data with 4 and 5. And from the findings, we found that most of the households struggle in getting a healthy diet, and the cost of a healthy diet exceeds the household expenditure. And also, we also find that when the food costs are very high, it's linked to lower dietary diversity, especially in rural areas. For more information on this, you can find me or Dr. Martin Chegere in booth number 56. Thank you.
Thank you very much, Doris, representing Martin Chegere. Next, we're going to have Laura Kasu.
Thank you. So, very long story short, as you can see, we found that there is a stark contrast between national food security and sub-national food insecurity. In South Africa, household food security depends primarily on total household income, as most of the food is not collected or produced at household or local level, but it's bought from larger scale supply chains, particularly supermarkets. Beyond income dimensions, we found further nuance in experiences of food insecurity and nutrition insecurity along the intersectional lines of inequitable distribution, and our findings point to a need to implement interventions that are truly equity-driven and pro-poor, in consideration of diverging trajectories of disadvantage in access to finance, livelihoods, food and nutrition security, health, life expectancy, and in the context of ongoing syndemics, both diet-related and outcome.
Thank you. We're going to have Ulemu Chienda.
Hi everyone. Ever wondered what happens when nutrition meets the farm? Well, my team and I dug into that literally and figuratively by assessing integration of nutrition in farmer field schools, and the results, tasty. Farmers were 2 times more likely to plan their meals and 3 times more likely to meet their dietary diversity targets. They were also able to adopt hygiene and better farming practices. This is proof that farmers can grow better and eat better. Come to poster 58 and let's grow more ideas together.
Thank you so much. Yes, can we have next Annette Adong right in the middle?
Okay, thank you. I want to bring to focus the concept of resilience, which essentially means when households are exposed to a shock or a stressor, they either get stressed or do not recover, or do recover to their previous levels. So we have these three pictures: a stressful scenario, households in hunger, but then households whose yields increased because of being adapted to the shock. So in this instance, we want to see the concept of resilience has been very difficult, no consensus on its measurement, on the how and the why, but now we use high frequency data to try to use the RIMA analysis.
Thank you.
Right.
Set?
Yeah.
We're going to have Busiso Moyo next. 1 minute.
Okay, let's go. So yes, thank you everyone. This research is about food system governance, rights and political economy in South Africa. What we wanted to zone in on in particular is the economic power of the food industry that translates to political legitimacy in the food system. But of course, power is discursive. So our point of departure was this constitutional fidelity that we have as a country around the codification of the right to food and access to basic nutrition. Now, our findings demonstrated a lack of imagination in a context like ours, reflecting the deep-rooted constraints in the political and institutional imagination surrounding food systems transformation. So in essence, to conclude, the findings reflect the complexity of achieving food justice in a context shaped by economic inequality, policy fragmentation, weak enforcement, and concentrated corporate power. So at the end of the day, this is about zoning in on the statecraft at play that allows the continued dominance of the UPF industry. There we go.
Thank you very much. Can we have Samuel Awoniers?
Good morning, everyone. Thank you so much. Our concern about this study is knowing why over 61 years of research in food security and huge investment into food security has not translated to reducing stunting and some problems that are associated with nutrition in Africa. So we try to look at some regions, sub-Saharan Africa to be precise. So we use a rigorous method, that's a methodology they are stated. So we found that governance and conflict have negative relationship with stunting. Then we also looked at, we saw some countries that are performing very well in terms of average stunting. Then we saw that governance and certain relationship, some countries are performing very well. And likewise, conflict impact, we look at it because that's one of the reasons and things that are endemic in sub-Saharan Africa presently. So we saw that countries like Burkina Faso and Nigeria had the highest stunting prevalence. So the impact is that if we are able to follow the policy, we are going to be able to do that. Thank you so much.
Thank you very much, our physical participants. Now let's go online. We are going to start with Deborah Naboma online.
Thank you. Centering the participation of community actors can leverage local knowledge and assets to address the demand for healthy diet. The scoping review assessed the application of co-creation and behavioral approaches into the environment intervention, and we found application in food retail, farming, and community settings. Majority of the studies showed moderate and comprehensive data engagement, and though the studies reported contributions of these approaches to adaptability, relevance, and acceptance of the interventions, we noted varied methods, indicators, and depth of reporting. We see the potential for these approaches, but it's multifaceted, and we see the need for comprehensive reporting guidelines, frameworks for systematic evaluation, models for scaling in diverse settings, and capturing the intricacies of actor engagement. Thank you.
Thank you. Next, we're going to have Lydia O'Meara online. Lydia, start.
Thank you. Now, we all know that it's important to monitor dietary narrative during times where risk of food insecurity is high, such as during the wet hungry season, pandemics, or conflicts. However, as many of us probably have experienced, it can be difficult to reach those remote populations during such times, not to mention expensive. So don't worry, we have a solution for you. In this study, we have validated the use of pre-recorded surveys on basic push-button mobile phones to determine minimum dietary diversity for women, women's dietary diversity scores, and percentage of women consuming unhealthy foods and beverages. We validated this innovative method against the gold standard weighed food record, and this mobile tool.
So thank you. Next, Betul Uya, online.
Yes, thank you. So, have you ever heard about the Diet Quality Questionnaire, also called the DQQ? This is a promising tool for collecting dietary data across the world. And in this study, we looked into its validity among 9 to 18-year-olds. We compared DQQ collected data to 24-hour recall collected data among 9 to 11-year-olds in Cambodia and 11 to 18-year-olds in Vietnam. Note that in Cambodia, the respondents were caregiver assisted. In this group, we saw that the DQ largely overestimated diet quality indicators compared to 24-hour recall, while in Vietnam, independently assessed 11 to 18-year-olds had comparable scores between DQ and 24-hour recall. So the scores were really small in difference between those methods. We conclude that this tool is valid to use among Vietnamese 11 to 18-year-olds when independently assessed. Thank you.
Thank you. Can we have Aisha Twalibu take it on?
We estimated the financial cost of the Maziko program, which is a maternal and child cash transfer intervention that is being implemented in Malawi since 2021 by Save the Children and Give Directly, targeting pregnant women, lactating mothers, and children under 5. We applied the same nutrition approach, combining financial expenditure data with microcosting to estimate the cost of program inputs as well as activities. Over the first 2 years of the program, the total financial costs were about 1.5 million US dollars. The largest cost driver by inputs was personnel, and by activity it was training, planning, as well as site supervision. For the cash transfers, the program spent about $500,000 US dollars to deliver about $2 million in transfers, meaning that for every $100 that was delivered to beneficiaries, it cost $28 to administer. These results help us to inform discussions on the affordability as well as efficiency of scaling up integrated nutrition programs like Maziko in Malawi. Thank you.
Thank you. Next, can we have Elodie Biko?
Hi everyone. This study presents findings from quantitative measurements of food intakes among adolescents living in the city of Accra, where unhealthy food are widely available. And its sister study presenting the out-of-home food environment surrounding these adolescents was summarized on a poster presenting on Tuesday. And my colleague sunk his presentation. So I will keep the same mood and I will share the essence of the results through an AI-generated poem. In streets where youth freely choose, fruits and greens often refuse. Sugars, fats, a tempting lure, their diets less healthy, less pure. 2/3 of foods from out of home, 2/3 of foods youth select alone. This autonomy, a double-edged sword, diminishes micronutrients stored. To turn the tide, we must inspire, make healthy choices more desirable. Online, this poster you can inspect. Go up to the slide 58.
Thank you. Next, can we have Angela Carriedo?
Review aims to synthesize public available information on the sustainable agriculture practices of Coca-Cola, PepsiCo, and McDonald's. These corporations are known to have substantial negative effects.
Hold on, Angela.
Yeah, sorry?
Hold on. Yes,
Yeah.
now you can start. Please start.
Okay, thank you. So this scoping review aims to synthesize public available information on the sustainable agriculture practices of Coca-Cola, PepsiCo, and McDonald's. These corporations are known to have substantial negative impacts on the environment and health. We identified 28 partnerships or programs, coalitions, joint ventures, and funding of nonprofit, including 5 partnerships with the UN. We found then ambiguous claims when referring to sustainable agriculture, raising issues of reliability, of corporate assertions. We found transparency issues, public information on self-reported actions, metrics, and impacts with independent validations were limited. We conclude that there is a pressing need to strengthen transparency, consistency, and methodological rigor of corporate frameworks and metrics. Public surveillance and pressures from grassroots movements and civil society actors are essential. Thank you very much.
Thank you. Next, we are going to have the very last but not the least. Can we have Francis Ebai Ndip? Take it on.
Yeah, livestock is crucial for smallholder livelihoods in Africa and affects the life of over 270 million people and helps household build resilience. But little is known about the dietary implications, despite poor quality diets being an important issue in developing countries. So the objective of this study was to look at the implications of livestock production on dietary diversity and consumption of animal source foods, and we use household survey data from Senegal with regression models. And our findings suggest that cattle, horse and donkey, goat and sheep are the most common livestock produced in the area, while the main results imply that livestock production is associated with dietary quality and the consumption of animal source food like milk, meat, and eggs. But we also unpack considerable heterogeneities based on the type of livestock produced. So we therefore conclude that livestock should also be considered in nutrition-sensitive agricultural interventions. Thank you.
Thank you. I would like to take this opportunity to thank our physical participants as well as the online participants. And of course, you, the audience, you're going to do the right thing right now is to vote for the best presenter. Thank you very much. I hand you back to Professor Zotto.